people need to get the best care and the best coverage and the best Medigap insurance to cover their own particular situation. Keith and his team do a particularly detailed job, and they not only do it once, but they do it every single year and keep up and take good care of their clients. That's why I partner closely with Keith and his network of professionals. If you're looking at anything with senior markets, if you know any elder people, you really need to have them call Keith. So this is my friend and my working colleague, Keith Nabb. And Keith, please share your presentation today.
Thank you very much, Angie. And yes, you are my friend and a valued confidant. And I really appreciate everything that we've done together. So today I'm going to share the screen and show you the blessings of COVID. So I really appreciate the vibe of this group. You guys are very a lot of humor and very loose, and I like this. So let's move forward and see if I can show you that everything about COVID wasn't bad. My agency is Affordable Medicare Solutions, and this is my 26th year, 26, and I grew up in Atlanta, born in Atlanta, downtown at Crawford Long Hospital, and opened my agency in Gwinnett County a long time ago, and it has evolved over time. In the last 15, 16 years has been focused on the Medicare. So this presentation we'll talk about is just the blessings, that there is a bright side and a silver lining to this whole thing. And we really did find a way to thrive during COVID. And that's, to me, is important. I did not know what would happen back in February, but let's talk about what we did as an agency to survive. The first thing we did, we prepped for the worst. I'm a worrywart. I'm overinsured, and I have 4 kids and 8 employees, and I want to make sure everybody's fine all the time. So we had an employee meeting on February 17th, and some of you heard that I'm going skiing this week. Well, that I got back on February 16th from a ski trip in Park City, Utah. I remember talking to the Uber driver that was taking me to the airport and said, you need to prepare for this virus. And he's like looking at me like I've got, 3 heads or something. He's like, what are you talking about? Well, I was watching this since January. And so we met with the employees and described what the CDC and the WHO felt would happen. We listed all the things that they should do to prepare, including buying food and toilet paper and other stuff. But we told the employees, look, our job is to provide peace to worried senior clients. We knew that this virus was going to affect my clients, the demographic I deal with, more than anybody. And just today, I've already sent out 2 condolence cards to clients that have passed away. It's just amazing the number of deaths we're seeing. It's bad. But we knew it was going to affect us, and we knew that we were going to have to spend a lot of time with grieving spouses and whatnot. And I mean, that by preparing the employees back on February 17th, it really got them in the right mindset that this was going to happen. They kind of looked at me like I was strange too when I was telling them all this. But we also described the things that would make their life less anxious. We wanted to make sure that they understood we were upgrading our phones, our computers. The payroll wasn't going to be interrupted. They were going to be working remotely, about how we were going to handle marketing. I think how we thought we were going to handle marketing, and also our public relations, to make sure that we were talking to our power partners and our business partners and our clients properly. But really the nice thing about this, and the blessing, was that it in any time of crisis, it gives you the chance to prove your leadership. And so my agency manager and myself, we were able to solidify our team. We were able to make sure that they understood that we really cared about their situation. And we understood that the stresses that they didn't even know they were going to face, that we knew that they were going to face. I knew the schools were going to close. I knew those things were going to happen based on what was happening in Italy and other places. So we let our employees know that, yeah, you're probably going to have your kids at home with you. So it doesn't matter if you're the mayor of a town and you have a tornado or a fire, a wildfire, or if you have a pandemic or a war or a hurricane. That's a chance for leadership to prove themselves and to actually that they're deserving of being the leader. Our model is different. We're an education-based insurance agency, which means that we like to teach about the subject matter that we deal with, which is Medicare. And I was teaching 75 in-person classes per year to professionals, to conventions, to nurses, to hospital workers, to consumers. And that just stopped. And I knew that was going to stop. In February, I called my continuing education provider and I said, what are we going to do? We can't teach these classes in person. I know we're not going to be able to teach them in March or April. And she says, I don't know. I don't know what we're going to do. Well, we immediately decided to switch over to Zoom, but the state agencies that provided continuing education wouldn't allow Zoom. And so it took them about a month or two to change their rules. So we ended up switching over to all sorts of things. And Angie, you and I did a bunch of Zoom classes together and figured out ways to do subject matter to provide information to the public and to our friends. We broker all the Medicare programs in Georgia. It's about 100 different programs, maybe more. And we do all of our services at no charge to the client. We get paid through the system, but it's all about education. And part of that we use the education as one angle, but the other side of it is what I call center of influence marketing. And center of influence marketing is referral-based marketing. It is finding centers of influence, whether it's your own clients or it is your power business partners, and to get them to understand it is normal. It is a normal thing, and condition them to understand that that's the way to build business. And I'll teach you in a minute about a book, but about 20% of clients are natural and friends are natural referrers. But you have about 40% more that you need to condition to get them to understand and to feel comfortable and how to refer. Maybe they didn't grow up in a family that felt comfortable doing that, but you can condition and teach people that referrals are the right thing to do. So this is the book. The two books that I really like the most, and I'll refer to you. One is called Don't Keep Me a Secret. And we've now converted that title to my own agency motto, which is Don't Keep Us a Secret. And then the follow-up book is called Beyond Referrals. And this guy, Bill Cates, is really good. I recommend you guys to read these books. Our referrals, since I read these books and implemented these things, our referrals went up 20% just this year alone. And our sales went up 15%. All the while that our education events, which are some of our main drivers of referrals, went down by 35%. So it was really, meshed well to be working in a referral-based system and centers of influence marketing during a pandemic. Here's our blessings that came from COVID. We got to test all of our systems, and we found upgrades that we needed. Some we didn't know about, and spent a few $1,000s upgrading computers. We found out that our older clients actually would adapt and Zoom. We were worried that they might not do this. My 84-year-old father is now Zooming with us. Another nice bonus was there's no mileage on our cars, no commutes or appointments or meetings. That is a bright side, and not sitting in Atlanta traffic. But the really good one for my agency was that all of our insurance applications are now electronic. We've been trying to move to electronic for 4 years, and finally we have no paper. The next best thing is that we get to record our Zoom classes. When I would teach classes in public, I didn't have a staff to record me. And now we can just push a button and record the Zoom class, edit it, and post it on our YouTube channel. So I got all this new content on my YouTube channel that we get to share with people to show what we do. Very, very good and no cost. We also proved that we're very resilient and very nimble, that if things change, we can react very quickly. But we confirmed that our marketing model was best, completely best for this disruption. It absolutely meshed together really, really well, and we didn't miss a beat. So here's my agency name, and the number at the bottom is the correct number for my office, the 945-5261. And our website is amsplans.com. So I hope I use my 7 minutes wisely, and we can go back to questions and answers. Tell me what you thought.
Go back to and anybody else can just either raise your hand or put something in the chat. What is it, Keith, that's getting the referral going?
Okay. So by using education classes, let me get back to that screen if I can get back to that. By using education classes, what we do is that those education classes can be sponsored by business partners. They can be cooperatively done with business partners. So let's say I go teach nurses at a hospital. Maybe a home health agency wants to sponsor the class. They get to go up and then talk to all these nurses, maybe 50 or 60 nurses, discharge workers, and say, hey, we're so-and-so home health agency. And then I'm the value add. I come in and do the class and give them a 1 hour continuing education credit. Or like Angie and I did, we did a series where Angie was a sponsor and she said, I'm going to bring in professionals to talk about Medicare and professionals to talk about long-term care insurance. So she does a session, I do a session, and another partner does that. Well, then that becomes good material to cause people to say, okay, all of these professionals are good people to refer to.
Other questions? I see a couple pieces.
There's a couple good ones in the chat.
Go ahead, Jared.
There's a couple questions in the chat.
Right.
One for me and one for you.
So who is a good referral for me? That's the first
Yeah,
one?
that would be Yuli.
Okay. The good referral for my agency is, of course, people that are turning 65, but a lot of times it's the adult children. It's these 50-year-old working women. It's generally the women that take care of their 80-year-old parents, or maybe their 70-year-old parents. A lot of times that sandwich generation is a great referral because they're like, I got too much going on. I got a kid in gymnastics and I got mom that needs to go to the doctor. I need help. And so we do all that work, a lot of that work with Medicare for them for free. And it takes a lot of pressure off the sandwich generation. So that's a really good referral for us.
So Keith, the conversation about referrals and referral marketing is, how are you getting to those people? How do you get people to come to your events? Or how do you get to that sandwich generation? What's, I mean, there's social media and there's friends and referrals and such. So how are you getting to them?
So about 50% of our referrals come from business partners that are centers of influence. And then about 30% of our referrals come from clients, which are centers of influence because they're referring their friends and family. And then the rest come through other channels. But of the 50% through the business partners, those are people that are dealing with families. And they are people that say, all right, I see a point of pain that's going on with this family. They need help with Medicare, and they refer them over to us because somebody is in crisis or somebody is moving. They've lost a spouse. Now they're moving into an assisted living facility. They say you need to review your Medicare. So those centers of influence send us over referrals to handle. We had about 1,200 referrals last year, so about 600 of those were business referrals.
So what are you doing for your business partners so that they either trust you, they know about you, they remember you? There's lots of reasons why all of us on this call could refer to each other for that matter. What is it that makes the center of influence effective?
A couple things. One is not stepping at all in any of their businesses. So I don't do anything with investments, taxes, life insurance, or any of those other things. So that if I have a power partner, they know that I'm not going to step into their world and provide any advice or any products that's going to take it away from their revenue stream. And they know that we are going to take care of the client not only one time, but we're going to be an ongoing resource for the client to make sure they're doing annual reviews. And what we do for that business partner is provide to them at no charge all of their, if we want to do an event together, we'll help do the production, we'll do the advertising, we'll do the materials, the education printouts, all the different support materials for free. So if somebody said, I want to do a class for my clients, a financial planner says they want to do a class for their clients, we handle the whole thing at no charge to them.
So Keith, the types of products that, I mean, are we talking like long-term care products?
No, Medicare.
Just Medicare programs.
Just Medicare.
Wow.
So we're the largest Medicare planning agency in Georgia. So if it's Medicare Advantage, PPOs or HMOs or Medigap supplements or drug plans,
Okay.
all of the Medicare world, that's
Wow.
what we deal with. And it's hard to do anything else. It's really hard to ride another horse. We do a little bit of health insurance because we have a lot of times a trailing spouse, one spouse that's 60 years old and one that's 65. So we do that, but Medicare is 90% of our revenue for my agency.
Okay. And so you work with individuals. You don't have to go through a company or an organization. So I get it. Thank you.
Well, I'm going to push back though, Jane. It sounds like to get to some of these prospects, the referrals are introduced to a group, like you mentioned.
Oh, for sure. Yeah.
Hospital. So Keith, if you can go back to how are you convincing the centers of influence to support you versus anybody else who is doing something similar?
Well, for one, we're going to preserve their reputation. So if they see our 500 or 700 different reviews on Google and Facebook, they're going to know that we're not going to damage their reputation. If a group health insurance broker refers us an employee, they know right off the bat we're going to take care of them, but we don't write group health insurance, so we're not going to steal their business. We're going to take care of them, and they're not going to hear back, hey, this guy or this team of people didn't take care of me. Because the group health rep wants to make sure that their reputation is not damaged. The financial planning rep, the CPA, whoever's referring us wants to make sure that their client is not calling back and complaining.
So can you dig a little deeper about how you do that? Because I get you don't want to have a complaint, but there's always going to be complaints, questions, confusion. Yep.
So we have
it's also, where's the client, not the client, but the referring partner. How do they know what's going on?
So we track everything. We have a very detailed system through Salesforce where we track an entire referral tree. So even if a client refers a friend, we know it came from Angie, for example. We know the tree on there. So we track it, but the way we do intake is very detailed. We do a full set of forms electronically through either texting or through email, where it comes back to us and uploads into our system. And I have a dedicated team that intakes the client, and then we build their files and do their reports and save everything in a very HIPAA compliant way. But then we let them know to do their annual review every year. And that way the client knows that they're not being set it and forget it, they're actually being managed. And 95% of Medicare agents just write a policy and you never hear from them again. And we want to be the exact polar opposite of that method. We want to be actively engaged with the clients.
Okay, so actively engaged. Any other questions?
Did you see Lee's?
Good question.
Yeah, good question. I can read it. He said, when most people think of Medicare, they think about government assistance. How would you explain the difference to a potential client?
Well, it is government assistance. The Medicare programs are subsidized at about $11,000 per year, about $950 a month per person. So it is government assistance, but it's not Medicaid. Medicaid is for the indigent or the poor. Medicare is for the normal retiring seniors. And it is, of course, it's socialized medicine. Half of America is on some sort of socialized medicine, but it is, people are excited to get into Medicare. If they've been in the Affordable Care Act and they can get out of the Affordable Care Act and get into Medicare, they're usually very, very excited because the plans are so much better. The Affordable Care Act plans are horrible. So.
All right.
So I'll
go ahead.
Go back to Jane and I were having a conversation about showing appreciation for your referrals, referral sources. And I'm curious, Keith, what you're doing. It sounds like you're updating your clients annually, so they're appreciative. Are you communicating with your referral partners with any certain cadence or in any certain way?
Yes, we do. We track those, and we Angie, what did you get for Christmas this year?
I got a plant. Special delivery. And just to let you know too, Keith and I we're doing these presentations. We were doing monthly lunch and learns at Hands Tooth Grill out near Chateau Valon. And I've done some presentations out there. Keith has some existing clients out there. It's through networking with those people that we started pulling in month to month lunch and learns. We brought in other professionals. One, if you're interested in long-term care, Michelle Perlow lives in Atlanta. She's an excellent long-term care expert. and she can keep up with that piece of the industry that has just far outpaced me. Michelle Perlow has done long-term care policies for several of my clients. Keith introduced me to Tracy Johnson, who is a Georgia premier healthcare professionals. Tracy and I worked our buns off over this Christmas holidays to get 24/7 care to a client of mine who is going downhill greatly, who works with Cumberland Trust and myself so I ended up getting to kind of step in and be a care coordinator, which I'm not qualified for. I called Tracy Johnson and she got people in line and put together within 3 days. I had a client who could no longer get out of the chair or get out of bed by herself. It was a very hard holiday and Tracy saved the day. His other friend who did bring me the plant, she's also starting a plant business, is a care coordinator. Just this past week, reached out to one of my senior clients and is going to help her get into a proper senior home, a client that is just near and dear to me. Going to help her get out of her house and into a senior home that will accommodate her and her needs. She's kind of gotten too old. She can't take care of her home and she really can't get it together to get it sold and get to the next place. And Jonna is stepping in.
So let's describe to Hal what that means. What that means, the big gift back to the power partners, the business partners, is that all of that resource, Medicare resource and aging resource providing. So if Angie calls me and says, Keith, I need somebody that knows how to move seniors from their home into some, I know that power partner. I have about 100, 130 now, different resource partners. And it's a blessing for all of these financial planners and people to say, I got a go-to agency that I can call, and they're basically acting like social workers.
Correct. And I can pass, it could be implied that I actually have responsibility and I should know these things. I do not. I am very limited on what my broker dealer covers me for. And I can get good professionals who stay in touch with me and give me a sense of, I'm very protective of my clients, a very good sense of control. And that way Keith coordinates with me about what's going on. I coordinate with Tracy. We all know what the big picture is, and we can really take great care of some of these seniors that do not have an advocate coordinating all these pieces for them.
I'll have families that'll call me because their dad's had a stroke and they're like, we don't know who you are. And they say, tell me, why did you make these decisions? Why did you do these things for my dad? And we have the entire history. We can show them everything to bring the family up to speed, because they weren't involved in their dad's life much until all of a sudden he had a crisis. And it really gives them a lot of peace of mind to know, okay, things aren't falling apart like we were fearing. They've actually got this stuff in order. And when people don't have a good agency behind them helping out like that, they're just grasping at straws, calling Medicare saying, I don't know what's going on.
So trying to keep this at a high level for just a moment as we wrap up, Keith, what you're saying is that some of the magic in you having strong referral partners, power partners, as you were calling them, is that you then become a resource, not just for Medicare, but you're building enough of a network to say, well, who can sell me property and casualty insurance, or who can help me with my branded merchandising or how to sing better, right? You've got all these people that are on this call. Okay.
Exactly.
So that's
what I call it, the aging spectrum. For really what we focus on is all the things that you don't know that you're going to need when you're aging. So it's a lot. It's a huge bunch of things that I've learned over the last 15 years that I had no idea about.
Any last questions before we go? Because this is Keith, and then
Can you help somebody that's already on Medicaid?
What's that, Jared?
Medicare,
I'm sorry.
Yes. Yeah, we get a lot of referrals for people that are already in their 70s and 80s because they didn't know there was a resource like ours. So then we take over their cases and we start managing it.
Got it. All right. In wrapping up, as it is 12:30ish, yes, we do keep a sense of humor that networking is kind of a big deal. And towards that effect, next week, Eric will be speaking about what you can learn from craft beer. It's very much a strategic conversation. And then another conversation again on marketing strategy with Eric on marketing in a virtual world. And Jane, who's on the call today, will be speaking about trends with merchandise, branded merchandise. And Scott, you can see the schedule. Looks like we got some really good conversations. Who's doing what and how we're going to generate more business, whether it's referral marketing or elements related to it. So Keith, thank you again.
Great job, Keith.
Well,
Thank you all for joining.
there's one thing to say is that be a resource, not a sales pitch.
Amen.
Amen. Good way to wrap
Okay.
it. Be a resource. All right, everybody. Have a great week.
Thanks, guys.
Great.
Thanks
you.
for having me,
Good one.
everybody. Thank you very much.